I'm Dr. Gabriel Trincato, owner of Triangle Concierge Physiotherapy. And for this episode, we are interviewing Dr. Alli with Practice Women's Health and Physical Therapy. And Dr. Alli is a specialist in women's health and pelvic floor therapy. And so just to, get going here, can you tell us, what is pelvic floor physical therapy, pelvic health physical therapy, or women's health?
Yeah, pelvic floor physical therapy is a specific type of physical therapy that focuses on pelvic and pelvic floor conditions. So things like pelvic pain, pain with intercourse, bowel and bladder leakage, constipation, pelvic organ prolapse, and diastasis recti, to name a few.
Cool. Great. Yeah, I haven't heard diastasis recti in a while, but I imagine seen a lot more commonly in your area, right?
It's super common. Almost 100% of women have diastasis recti at the end of pregnancy, and up to like 32%, I think it is, 6 months postpartum. So it's super, super common. We
Yeah,
see it.
yeah. I remember my wife asking me about that after, her pregnancy with our son, and you know, I'm like, well, I'm digging back into my PT school knowledge
Yeah.
because it's been since then that I've seen it. So,
Yeah, for sure. Just an interesting fact, we also see it in people who are overweight. So, um, lots of times I see older men who may have just gained a little bit of weight and they have a diastasis recti. So it's not just limited to pregnancy either.
So it's really, would you say it's more associated with that expansion of the abdomen?
Yeah,
Yeah,
whether from, weight gain from a baby or just weight gain in general.
yeah, yeah. I mean, there are definitely some people with that almost pregnant looking belly, and I can
Yeah,
imagine that would
exactly.
stretch out those tissues. Yeah. So, um, so that kind of leads me to my next question. Is pelvic floor PT only for people having babies? But you kind of already alluded to that not being necessarily true.
Yeah, not necessarily true. While we do see pregnant and postpartum women, of course, we also see women who have never had children. We see older women, and we even see men and kids in some cases.
Yeah. Cool. That's awesome. And so it's really anybody dealing with pelvic pain with intercourse, right?
Yep, pelvic pain, pelvic floor dysfunction. So that includes bowel and bladder issues. A lot of times with kids, it's more of like, constipation, kind of holding their stool, potty training, and things like that. Obviously, there's no kind of internal exam with children. It would just be more educating the parents and teaching the kids how to contract and relax their muscles.
Yeah.
Um, yeah.
Cool. So let's talk about some myths and misconceptions because there's plenty of that, all around. But speaking of leaking in urine with kids or after kids,
Mhm.
is that normal or just common?
I would say it's common, but it doesn't have to be acceptable. So many moms assume that it's just a normal part of being a mom, right? But we don't have to settle for that. And it really is possible to do jumping jacks and jump on a trampoline again after you have a baby if you want to.
Yeah. Yeah, I've definitely heard of numerous people wanting to get back into running, but it's like, hey, I can't run more than a quarter mile before I start to
Yeah.
peak and, basically pee my pants.
Yeah. And you
Um,
don't have to.
um, and you kind of mentioned that point too. Do you need that internal exam? You mentioned with kids that obviously that wouldn't be done, but is that necessary if you need pelvic health PT?
It's not required. So for some folks, it can shed more light on a situation. Sometimes it can allow for a more specific treatment plan or for things to get better faster. But for some people, it's just off the table. They're not comfortable with that. And that's totally fine. We can work around your preferences. Um, I actually offer virtual visits, so there wouldn't be an internal exam in that case.
Yeah. Okay, cool.
Yeah.
And give me, if you could, just one of the most common myths that you've heard about pelvic floor PT.
Uh, a common myth that I hear a lot is that it's all just Kegels, right? Kegels are not appropriate for everyone. So some people have pelvic floor tension or tightness. So tensioning more on top of that would cause a problem or could cause a problem. And even for people that are doing Kegels, it's more than just simply Kegels, right? So you have to be able to coordinate that contraction with your breathing, with your abdominals, and then kind of integrate all of that back into an actual function like squatting or lifting a toddler off the floor.
Yeah, cool. Yeah, I've even heard of people initially having tense pelvic floor
Hmm.
at one point in time, and then having had children, and then after that they're having trouble tensing it. So it's like depending on your season of life, I've seen that change. So it's not that you always deal with the same issue, right?
Yeah, that's a good point. There could be times in life where Kegels are appropriate and times where they're not. And pregnancy and childbirth, there's so many changes that things can look drastically different before and after,
Yeah,
too.
right. So let's see. When should you seek out pelvic health PT?
I would say anytime that you're concerned or dissatisfied. I think a lot of people are hesitant to come to pelvic floor PT because they feel like maybe their problem is relatively minor in the state of the world. But you don't have to live with minor symptoms either. You don't have to wait until things get worse. And there's really no problem that's too small, and it's never too late to get started.
Yeah, that's great. That's really encouraging. So can pelvic health, physical therapy help people who are dealing with, say, back or hip pain?
Yeah, for sure. So the hips and low back have a lot of, they share muscles and attachments with the pelvis. So sometimes problems in the pelvis can actually cause referred low back or hip pain. And then obviously back and hip problems can affect the pelvis and pelvic floor as well. So it can be really helpful for those folks to have a pelvic floor assessment, even if it's just to rule out the pelvic floor as a contributing factor to their hip or back pain.
Yeah, that's awesome. Yeah, and I think it's very important to always rule out some of the those adjacent areas. So,
For sure. Yeah. If your hip or back pain is tricky and you can't quite figure out what's going on, maybe you've already had physical therapy, that could be a time to say, well,
mhm.
maybe, what about the pelvic floor? Let's rule that out.
Yeah. How about, people who are dealing with, you mentioned pain with intercourse. I feel like people might feel like they should be assessed medically,
Mhm.
because that can be a scary thing. But do you feel like it's always necessary to be medically addressed, or should you go first to a PT?
I think anytime that lubricant and changing positions doesn't solve the problem, um, it should be medically addressed because that solves a lot of problems, right? Um, Pain with intercourse can be caused by so many different things. It could be a pelvic floor, a muscular problem. It could also be an infection. So, if a few simple fixes aren't doing it, you should see your doctor first, even if they clear you and then send you to PT.
Right. Yeah, I think that collaboration is definitely important.
Yeah, for sure.
Okay. So if somebody is dealing with some pelvic floor pain, and they're still trying to work out, they're still trying to run or you know stay active, how should they modify their training if they're having these symptoms?
Yeah, so if you're having symptoms with training, I would start by lightening the load. So, for example, if your problem is leaking when you do back squats, I would lighten the amount of weight that you're squatting to the point that you can squat without leaking. Or if you're a runner and you're leaking when you run, I would slow your pace and or shorten the distance that you're running to the point that you can do it without symptoms. And then you would work with your pelvic floor PT to address the underlying problem as you kind of build back up to where you were.
That's great. Yeah, so people don't have to stop cold turkey what they're doing and lose all the progress they've made, or get worse, right?
No, actually, telling someone to just stop doing CrossFit or stop running as a solution is not sufficient, in my opinion,
Yeah, I think it's bad advice, but it's the quickest advice. For a lot of times, people don't have the time to spend educating their patients.
for
If I
sure.
hear people being told that a lot, or that's the decision they make because they don't know better, right?
Yeah, absolutely. There's a lot of benefits to CrossFit and running. And there's a lot of mental health repercussions if you just tell someone to stop to what
Yeah,
they love.
absolutely. Yeah, definitely. Yeah, I mean, I work with soccer players who, maybe have back pain after an accident, and they now they haven't worked out or, done that recreational thing that keeps them sane, right? Like once or
Yeah,
twice a week, and they're like, well, I can't play soccer because I, hurt my back, and so, I don't want to damage my back. It's like, okay, well, you're only being more sedentary, and that's only going to potentially worsen your back,
for
condition.
sure.
And so being able to at least participate in some manner, I think is a big deal for people, both physically but also emotionally, psychosocially. And it just helps them along so much better. So I think that's a
Absolutely.
really big encouraging point. So thanks for
Yeah, I totally agree.
that. So going back to, postpartum, when is the right time to start, pelvic health PT?
Yeah, so often doctors will release you back to full activity at 6 weeks postpartum. This is the point where we could do an internal exam. Um, However, there's a lot of things you can do during those first 6 weeks to prepare your body for that increased activity at 6 weeks. Um, so, if you're going to pelvic floor PT during pregnancy, you should definitely ask your PT for a list of exercises you can do during those first 6 weeks until they can see you again.
Yeah, that's great.
Yeah,
Just dosing appropriately, right?
absolutely.
Yeah. So can say somebody doesn't come to their PT right after, um, or for some reason they just didn't get around to it, and now it's been years, or they didn't realize they could get PT for that.
Mhm.
Is it still too late? Is it too late for people after many years to get help?
No, it's never too late. To be honest, I've seen people come in their 80s who had their last child 50 years ago, and they've never heard of pelvic floor PT until their doctor told them about it last week. Um, and while we can't totally reverse aging, and there's a lot of age-related changes that are normal, we can always help you learn more about your body, improve your coordination and your strength, and just help you feel more confident during your daily activities.
It's great. Yeah.
Yeah, never
That's
too
awesome
late.
to hear about, the 80-year-olds coming in for physical therapy.
Yeah, I see
But
so many of them.
they tend to be the best patients.
And it wasn't super common, back when they were postpartum, right?
Yeah.
50 years ago, pelvic floor PT was pretty much unheard of.
Hmm.
So,
Yeah.
you might have PTs that could help with, in the pelvic region, but specifically pelvic floor PT was not really a common thing where you were referred postpartum back then,
Yeah.
unfortunately.
Yeah. Thankfully, medicine has advanced quite a bit since then. So
We're getting better.
yeah. Um, I feel like we kind of addressed this point, but when should someone seek pelvic health PT versus going to their medical doctor?
Yeah, great question. So, if you're having unexplained bleeding, you're passing large blood clots, you think you might have an infection, or you're having like severe or unrelenting pain, you definitely need to see a doctor. Um, if you had a baby more than 6 weeks ago and you just want to get back to CrossFit or back to running, maybe you're having a little bit of leakage or some constipation or pain related to movement, then PT is a great place to start.
Yeah. That's great. And I think those are great points to highlight. These are the reasons you should definitely go be evaluated medically, and these are
For
the
sure.
reasons you should definitely just come on in and be seen for physical therapy. So that's great.
Yeah, and even if you start with PT and your PT sees a red flag, they're going to let you know, hey, I think you should go see your doctor before you come back.
Yeah, yeah, that's great. Yeah, we definitely have the training, right, to screen for these more serious issues, and that way we can point people in the right direction.
For sure. Yep.
So, where can people learn more about, pelvic health PT, and, whether it's right for them or,
Yeah. Um, well, I'm on Instagram at Practice Women's Health. I also have a website, practicewomenshealth.com. I have some blog posts on there that talk a little bit more about what pelvic floor PT is, what to expect in a visit. So you could check that out. I'm also always happy to jump on a phone call if somebody just has more questions and wants to find out if it's right for them. I can always chat with you over the phone.
That's great. Awesome. Well, we'll definitely we'll link those the website and your socials to the description so that people can find you more easily. And maybe we'll take some additional questions that people might have, and we can go a little bit more in depth about pelvic health specific PT and in athletes and in older adults and postpartum and just dive a little bit deeper. So uh,
Yep, be happy to do that.
yeah, awesome. Well, thanks again for providing us with your expertise and answering some of these questions that I think are fundamental for all people to really to know and be aware of how valuable pelvic health is and pelvic health PT specifically can be to those issues. So thanks
Yeah.
again.
Thanks for having me.